What we are trying to do is to actually create a holistic program that's scalable throughout India for communities to live in partnership with the planet. So I think that's very, very important. Once you give these communities financial stability, build a trust with them, then understand what their needs are and bring wellness into their life, automatically their health improves. So we've seen that giving them a bit of education and empowering them has a huge impact on their health. So that's what we are doing in a nutshell with respect to total health for the Amrabad Forest Reserve. And I'm very, very proud to say that, with this project, we've actually given these women a sense of livelihood, a sense of ownership, and as a byproduct, the tiger population has actually grown in the reserve. It's foolish not to make them a part of our society because they are the ones that are closest to nature. If we cannot understand and work with them, our barrier with nature will never be fulfilled. So what we need to do is to understand their way of working, their way of life, teach them the important things so they can also know how to balance the human-wildlife conflict. If they have that basic education, I think we will have a much safer and more stable planet for the future. So it's very important to keep tribal welfare, tribal life, and respect them as much because they form a huge part of our society. See, the government does a lot. I'm very, very impressed with what the government has done with respect to COVID and how they handle the whole situation. Kudos to the government. They've done an amazing job. There are also a lot of schemes that these people don't know about. So what our main job with the Arjava warriors is actually to empower these people who are Asha workers, Anganwadi workers, Balwadi workers. We empower them with education on definitely healthcare because that's our core competence, but also about how to preserve the planet and hygiene. So once you put all these aspects together, they have more education than what they would get as just an Anganwadi or a Balwadi worker. So that's what we want to do with our Arjava warriors, and we want them to become champions of the community they are in so that that community can thrive. If this model works, and we've seen, with the PHCs, the outcomes of the PHCs and the outcomes of our satellite clinics actually there, we've seen that, the community is much stronger. We've seen the recovery rates are better. We have research to show it. And we've seen that the community is more tight-knit and more health-oriented in this way. So taking that into consideration, I think that the Arjava warriors will be a huge, huge help in the country's growth as a healthier nation.